Hey, welcome to Tuesday Talk. Okay, today I'm going to talk to you about something that's getting a lot of publicity in the press, and that's breast implant associated anaplastic large cell lymphoma, and that's sometimes abbreviated BIALCL. Okay, so it's a very rare cancer that people have been associated with breast cancer, and it's been described about 20 years ago, but now it's getting a lot more attention in the news media, and of course that raises the public awareness, which is a good thing, but it also raises concerns. So who gets BIALCL? The typical presentation is somebody who had an implant about 8 to 10 years ago, and then they developed swelling in the breast and a fluid collection. Now, anytime you have any changes in your breast after an implant, you should see your plastic surgeon. That should go without saying. The majority of times, even if you do develop a fluid collection, it's benign, okay? So that's the most important thing to keep in your mind. Now, to date, there have been 688 cases of ALCL associated with breast implants worldwide, okay? We don't truly know the incidence, but that's how many cases have been reported so far. And there have been 17 deaths because of that worldwide, okay? So it's not very common, and the treatment is very good for it. What is the treatment? The treatment is to remove the implant and the entire capsule. Some people even put in a new implant, okay? But that's a more advanced discussion beyond what we could talk about here. 96% of women who developed the ALCL will have some sort of changes in their breast, usually, and that's fluid collection enlarging in the breast. So that's a very common presenting sign. What happens if you get that? Number one, see your plastic surgeon. Typically, you will get an ultrasound. If there's fluid, the fluid will be removed to be sampled, and they'll send that for testing, and that testing will tell you, do you have ALCL? Are you somebody who may be likely to develop ALCL, or is it completely benign? Which is the most common situation, still most commonly is benign. Now, to date, there have been no cases of ALCL in smooth implants, okay? For breast augmentation, I almost always use a smooth implant unless somebody wants a shaped implant or a gummy bear implant. So it is very unusual that I use a textured implant for breast augmentation. Now, when you further break it down and you look at textured implants, the so-called micro texturing, which is the ones I tend to use, their chance of having ALCL is about 1 in 82,000. And when you look at the macro pores, which I tend not to use, although sometimes we will use those for breast reconstruction, the chance lifetime is about 1 in 3,200. So it is significantly more likely in people who have macroporous or macro textured implants. Okay, so if you have smooth implants, it's not been reported, but again, you should always be evaluated. If you have any questions, please feel free to call our office. Thank you.